The matter of social media, you're going to hear pros and cons and good news and bad news about it. I will tell you, if you are a frontline healthcare covered entity, I would advise a very, very aggressive position on the use of social media sites by organizations when it involves your patients or your members, thanks Karen, protected health information. I don't have a sample, I don't have a template to provide to you here, and we're a little limited on time, and I'm sure, sorry Sharon, I'm glad you reminded me, but I didn't remember to address this specifically. I would encourage you to take a very, very aggressive attitude about that, and in the form of acceptable use of networking and computing resources, it can be addressed there, and separately it can be addressed in a separate social media policy. Organizations, Sharon reminds me that there are certain organizations that have been taken to task or at least challenged by the National Labor Relations Board because of, I'll say, stringent policies around the use of social media and perhaps affecting adversely individual employees' rights in an environment. And I think that may be the case in certain circumstances, but my personal point of view is that when it relates to patient information, you should be very, very stringent about it. I've got a series more of questions here. Sharon, let me move on. I know that wasn't perhaps as full a coverage as you want. Ashley asked the question, what was the percent of employees who said their organizations don't provide proper training? I think that number was 51%, Ashley. Meredith asked, do you know of any services that can audit our policies to see if we're on the right path? And